Don't Mandela, even Franklin Delano Roosevelt said, now he had enough sense to say, there's nothing to fear but what? Thank you very much.
Hallelujah.
I'm sure you've had your mind stirred by the previous presentation, and it's very important to understand that the examples on one plane are giving you details on another plane. The examples in the physical plane will clue you into what's happening on the mental plane. And if you understand that, you have a better chance of understanding what's happening on the spiritual plane. Because what we'll talk about vitamin D is an example, and at least start to go into it, of things that affect your body and your mind or your soul. So to see that, it has to be something that was placed there first, a receptor, so that it can respond to the vitamin that now is available by food source for sunlight. If there was no receptor in any cells, then it would be of no effect. So the preparation had to be made by the one who made you to want to desire, to need something. Then when you receive that something, there's a greater joy. That joy in the physical body we're going to talk about with vitamin D is the answer to what Lee put up here was seasonal affective disorder. And if there was no need for vitamin D, then how could vitamin D prevent depression? So you could work backwards and say, therefore, there must be a tremendous physical need for vitamin D, whether it's supplied by food or whether your body makes it from the sun. And it just so happens
there's three ways.
is if a newborn baby needs 400 units a day, and that baby is 7 pounds. Let's say 10 pounds, you know, like easy math. So now here's a 100-pound woman, you know, a teenager, 10 times bigger, and she needs 600. You do the math. I mean, my patients are a little bit more than 100 pounds. So if you use 35 units per pound, that means at 100, you need at least 3,500. So a 10-pound baby needs at least 350 units. Somebody 200 pounds needs at least 7,000 units. So you can just copy that website and you'll be reading forever, but you'll be more educated than 99% of people just from that one website. Because you need knowledge. If you don't have knowledge, you're going to be, I talk to doctors every day. I'm the chairman of surgery at Advocate Trinity. And we have a little doctor's cafeteria within the cafeteria. And I think it's a good idea because the doctor can sit down and consult each other and don't have to worry about somebody overhearing them talking about somebody or talking about a condition. So I introduced the subject of vitamin D. And a year or two ago, nobody knew what the heck I was talking about. Now they say, oh yeah, I'll test some of my patients, but you only need 200 or 300. You only need 400 or 600. And so I asked them, if these guys are coming out in Institute of Medicine saying you only need 600, and you, from your research, said they need to need 1,000, then they asked me before I could ask them, well, why would they do that? I said, well, when you find the answer to that question, you'll be more skeptical than you are even now. I said, because why would they do that? Why would they say the baby doesn't need to breathe that much, let's choke it? There's only one answer. They're, you know, not doing something in the best interest of the situation. And they claim it's what? You need a double-blinded, case-controlled study to prove it at the level of evidence for us to come up with a recommendation. Well, let me tell you, folks, nothing has ever started by a double-blind case control study. In other words, that scientific level of evidence has never been the basis of starting any treatment. That's only available 50 years later after everybody knows it works anyway. And you get academic credentials to do that and say, this is the best kind of study to prove it. By then, everybody knows it works. So let's look at that liar, because I'm really talking about a principle, and that liar started lying right from the beginning. So if you want to understand this lie they started telling, then you got to go back to the lie that was back here. And if you go back to the garden, he said, surely you will not die.
Yeah, right.
Surely you will not die. Go ahead. So here they're twisting a little bit. Yeah, you need vitamin D. You only need about 600. And we're doing great because we told you that's 300 times more than we used to tell you. Because we used to tell you don't need too much. So if you look at that principle, let's see what else they lied about. And then I'll get to vitamin D. How many of you remember, maybe I mentioned it or maybe read about, in this century, the Eugenics Society was steadily telling people, oh, you know that cornmeal that we're sending out everywhere that's not processed properly, that doesn't cause vitamin B1 deficiency collectively. So for 10 years, half the scientific academics said, you got to change that cornmeal because people are dying because of B1 deficiency. That's right. They said, no, it isn't. That is no way does that happen. So it took 10 years before enough of the scientists on one side proved absolutely that they were full of it, and then they had to retract. But they had more people down for 10 years. Why would they do that? When the cigarette tobacco industry controversy came up, they paid scientists to provide studies that show cigarette smoking doesn't cause cancer. It doesn't do anything. For 10 years, people were tricked. And I distinctly remember that because I had just finished medical school within a few years. And my dad was trying to tell me that because he smoked 5 packs of Camels a day. And he was telling me, oh, they have studies I saw on TV. It doesn't do anything. I said, hold it. Who are you going to believe? Them or your son who you just helped finish medical school? He said, well, I don't think it does that much. So, because they're profiting from it, they'll make up a lot. Then it's hard to believe, where is the Institute of Medicine profiting from not telling the truth? Somebody has to be telling them to withhold it. And as I talked about before, it's clearly evident in 1,000 of research articles. If you go to we don't have to do that, PubMed, if you do vitamin D deficiency, you get to the government listing of research articles. Thousands of them say vitamin D has a tremendous effect. And within the next 10 years, even with them fighting it, if things permit, they will then have to admit in 5 or 10 years, breast cancer is just a vitamin D deficiency disease. Diabetes is a vitamin D deficiency disease. And they'll go down the list. And by then, it'll be like, oh yeah, everybody knows that now. But they're going to fight it until, right. So there has to be a reason behind it. And the point I'm getting to is that, is this the only one that works? Or is it
Yeah, the black. Should be black up there, Joe. Look on the desk.
I'm going to leave this here, but from the radiation from the sun, you have ultraviolet B that is highest, let's say from 10 to 12. Noon, 10 a.m. to 12. No, 10 to 2, sorry. So the majority of scientific pronouncements now are stay out of the sun. Because of your skin cancer. But the other articles say the ultraviolet B that produces vitamin D prevents the skin cancer. Reasonable exposure. So, Lee alluded to it earlier, your body makes, let's say a white person, 1,000 units per minute if you're in your bikini, your bathing suit. 1,000 a minute. 30 minutes, that's 30,000. An hour, that's 60,000. After it gets up somewhere between, over 10,000, your body starts decreasing it at the same rate as making it, so it's steady state. That's why people in the sun don't get toxic. It is possible if you take 100,000 units a day for like 2 or 3 months, you can get toxic. But if you're in the sun, you're not. They've also had studies that show if you take vitamin D and put it on your skin, that it helps your skin. So it's hard to believe and it's hard to explain because people really don't want to know. And if you do want to know, it's because somebody put something in you to make you want to know. So in a way, I think that's luck, or we can get into that discussion later, but who could really understand and accept the fact that the vitamin D is made from cholesterol? That's your body put there, and that it takes up to 48 hours for it to get absorbed. Uh-oh. Does that mean you ain't supposed to take a bath? It does mean if you take a shower every day, you're getting rid of it. So ideally, when you go through this site, you'll hear them talk about, well, you should, do a bird bath and let the vitamin D do its action in the skin layers. Who can hear that? Animals get vitamin D, but guess what? They have to lick it off their fur to get it. Once their skin makes it, it comes to the surface. They lick themselves. That's how they get their vitamin D. But that's too much information. Now that makes us think. Didn't you just say that Lee was talking about the last generation? Or maybe that was on the radio. They don't want to think. They want to play a game where you're killing something, blowing something up. But give them a book, they're like, I got to read that.
So you saying that in the summertime, if the person takes a lot of showers, they wash away their vitamin D?
Right. Absolutely.
Really?
Absolutely.
Because in the summertime, it's hot and it's sweaty. And sometimes I might take 2 or 3 showers.
Absolutely. And that's why if I want to test everybody here, I can go along the line and say, how much fish you eat? Sardine, salmon, herring, mackerel, anchovies, cod liver oil. No, y'all didn't think that? All y'all under 10. Everybody's under 10. I tested patients last week, one of them was 2. The lady from Mississippi that ate all 6. Salmon, herring, mackerel, sardines, anchovies, and she took cod liver oil. Hers was 43. To prevent breast cancer, it should be over 60 nanograms per milliliter. But they would tell you, because to prevent rickets, all you need is around 12 to 16. And if you're 20 or 30, then you're cool, right? No, you're not. 50 to 70% of cancers possibly can be prevented with vitamin D levels up to that level, up to at least 60 to 70. And if you have heart disease or cancer, if you get your vitamin D level to 70 to 100, it treats the condition. But they'll never tell you that because they're in denial. Even though the studies show it, we don't have case-controlled trials that prove that it works. When you have case-controlled trials that prove that radiation and chemotherapy works, it kills you.
Why did they set the guidelines for your labs at 30?
Because 30 prevents rickets. But the lab will say 30 to 80 is normal.
Oh.
Your doctor will say, oh, you're over 30, you're okay, that's normal.
Okay.
In the old days, they said the range of cholesterol was 200 to, 350. So if you had a cholesterol 300, they'd say, oh, you're within normal range. But they forgot to look and say, those people die 5 times more than the ones who's under 200. They forgot that part.
So how much vitamin D should one take in a day? 3,000?
I would say consult your doctor. That's not an excuse. But I take 10,000.
10,000?
I tell my patients to take 5,000.
Take
5.
And if you get tested and your level is over
Sometimes
60,
15.
then you know it's working. If you get tested and you're taking 1,000, I've mentioned before, one of the doctors I talked to finally told me, she says, look, I believe you, Dr. Thomas, now. I said, well, why do you say now? Well, I tested my patients, they were all low. She's dark skinned. So she said, I know I'm low. So I started taking 1,000 a day. And after a year, I said, let me just see what I am. After a year, her level was 16. So for every 1,000 you take, it bumps you up 10. So that meant a year ago she was 6. And that's what I told her. I said, I could have told you, if you're not taking 5,000, you playing. Now, the white girl that gets a bikini, or anybody in here that gets the sun during the summer, you don't need that much because you're going to make it natural. You got teenage boys, they play basketball, a couple hours in the sun. They don't need it at all during that period of time. As soon as it's November, I don't care how much sun you get in Chicago, none is going to be made until after March.
So, for example, would vitamin D help a person, obviously deficient, if they've got diabetes, hypertension, prostate cancer?
Well, there's studies that show, for an example, there are men who've gotten, I'll start with prostate cancer, who've gotten prostate cancer at 60 or 70, and for whatever reason they said, hell no, you ain't cutting me or doing chemo. They said, well, would you mind being in the study? They said, fine. Some of them, they said, they're not going to take nothing. The other ones took vitamin D. And then the regular group, their regular group, had surgery or radiation or whatever, right? The group that got vitamin D did better than both the other groups. In the petri dish where the cancer is growing, apoptosis, the death of cells, particularly cancer cells, once they put the vitamin D in that culture medium, 10, 20%, I forgot the number of the cells just started dying. Because those cells have lost the message that they're supposed to grow for a while and then die.
So, I have a wellness ministry. Now, with this 5,000 milligrams of vitamin D,
I use international unit.
I use, okay, 5,000 I use. Would that help the person that's in those categories, cancer?
Let's look at it this way.
Diabetes?
How could being vitamin deficient help anything? Let's start with that. That's the safest place to start. Get your level checked and see if you're deficient. If you're deficient, how can being deficient help anything? So if you start with that, you have less argument. You're going to get fallback because the people are going to say, oh, I heard that thing on TV. That's too much. Get tested and see. Oh, your level is 6. How can you think you're going to get better if you're deficient? How can you pay your bills if your account is in the red? How can you run up the mountain? You have an asthma attack now. You can't breathe sitting down. If you have a problem and you're deficient, you need to correct the deficiency. So to answer your question, several nurses that I talked to have husbands of themselves. They started a 5,000 vitamin D. Within 3 weeks, they had to stop taking one high blood pressure medication and stop the diabetic medication. Don't tell nobody though. We don't want people getting well.
Make no money.
Rickets is basically the bones aren't formed right. So in a little baby, you'll see the baby's legs are all bowed like that. And with enough vitamin D and calcium, it'll straighten out. So and that's easy to cure. So that's why they said all you need is, basically, a couple hundred. So let me finish this. So this is ultraviolet B. So we know, okay, vitamin D is produced in the skin, and you need it. But what else do you need from the sun? See, there are things you know, and there are things you don't know. And I guarantee you, the things that you don't know are greater than the things that you know. That's right. So this is an example to set up a situation where you should have faith and confidence that if the one who made you gave you an example that your health depends on the sun, and here's some evidence saying this is what we know, there's far greater health benefits, a life-giving energy that you get from the sun. So when I grew up, I thought only plants need the sun. You eat some plants, but come on. I don't have no chlorophyll. I'm not doing a photo electric effect or whatever. However, as it turns out, there's more that you don't know. And the problem is, if you have received something that lets you know there's more that you don't know than you know. And you can be open and say, okay, Yahweh, show me. Because I know our bodies are fearfully and wonderfully made. And that there's more to be shown than what you have received. But if your cup is already full, how are you going to pour some more in there? You know everything. So as I was back to my discussion, so I'm sitting down with the docs, they know everything. So how they gonna listen to me? I say, well, do some research yourself. Go online, just Google vitamin D deficiency. When them thousands of pages pop up, you know, pick an hour, do some reading. Because if you wait for them to spoon feed you, you're dependent upon the motivation and intent of the one who's giving it to you. I see the one who's giving it to you is going to tell you the same thing. You won't surely die. Go ahead. That's right. Cut back on that vitamin D just to 300. Especially you African American, because did I tell you, the darker your skin is, it'll take up to 6 times longer.
Right.
So the white, because your pigment is blocking the sun.
You need the
So if the white person, the lightest person is making 1,000 a minute, and in 20 minutes, they got 20,000 units made. Just multiply that times 6. That's 2 hours for everybody in here. Just about. So you need more sun. And that's just for one thing. What about other things? So how does it affect the ultraviolet? What about infrared? The far infrared is a radiation you feel that, let's do it like this. We got to put it in a frame, you know. How many have like some transition lenses? So I used to get in my car and they were cool because they would change when the sun came out and I didn't have to have other ones. Now they don't work. Why? They put ultraviolet block in your car windshield.
Right.
Now I got to get some sunglasses.
Right.
But wait a minute. That means the wind, the glass can block some of the ultraviolet light.
Right.
So here you are in the summer saying, I'm getting plenty of sun. You're not getting no ultraviolet B.
Right.
So even if you're indoors in the summer, you're not getting ultraviolet B. It's blocking it.
So can the supplements really replace the
Absolutely.
sun and foods?
Well, the problem is to get all the supplements you need from food for everything, you probably have to have about 10,000 calories. So that means you'd be like
Yeah.
1,000
Is
pounds.
fish makes, you said sardines, fish.
Those 5 fish, you know, there's so little in catfish. I hate to mention it,
Yeah.
but then you think, well, I had some catfish, I got it. You ain't get nothing.